Hi everybody, we are doing the cell to 116 and we come from the Faculty of Physics, Hanoi University of Science. Our team have 3 members. I am Đỗ Quang Lập, team leader, and the second member of our team is Trần Quốc Huy and the Oliver is Nguyễn Thị Hải Yến. Today we take part in the MCU contest in 2014 and our product is smart monitoring system for human health. And we want to contribute TI microcontroller skills and experiences through this contest. And our device will use the TVC launchpad contain TM4C123 MCU. And this is a new microcontroller technology instrument in Vietnam market. As you know, with the constantly increasing pressure of society, cardiovascular disease appear more and more with a serve consequence, and the heart rate is a very important parameter to decide whether they have a disease or not. The main purpose of our research is designing a recorded heart rate device. In accordance with the affordability of small hospital, patients can afford a smart, healthy monitoring system that they can use in their house. With our product, the interaction between the patient and the healthcare center become easier than ever. This is the first step in research and development of the smart healthy monitoring system in humans. In case of abnormal heart rate, the device will automatically communicate with the healthcare center and decide what it should do. As being shown on the figure, the amount of light that phototransistor receives is inversely proportional to the amount of blood cells in the blood pressure. And the change of the amount of these cells will depend on the beat of heart, and hence heartbeat will lead to the change of the voltage on the collector pole of the phototransistor. And by detecting the voltage created by the beat of heart, its rate can be easily observed and used for a number of purposes. And it consists of all that transmit a light signal through the frequency of the subject, a part of which is absorbed by the blood cell and the transmit signal is detected by the phototransistor, so on the figure. And next, I will introduce to you about the schematic. As you can see on the figure, our device includes 6 main blocks. The first block is a signal conditioner block. The second one is a power supply block. Next is a SIM900 block, an indicator block, and peripheral block. And the main block is MCU. We use the TVC launchpad, which consists of TM4C123GH6PMI microcontroller unit. How about the algorithm? As you can see, the algorithm is an infinite loop. And when we start from the beginning of the main function, we must check the variable reject. If this variable equals 1, the MCU will send SMS with the contents of OK status, display on the LCD, and pull down the reject variable. And next, we must check the SOS variable. If this variable equals 1, the MCU will send SMS with heart rate and GPS location. After that, it will pull down the SOS variable to logic level 0. And next, we will have to check the status variable. If this variable equals to 1, the MCU will send SMS including heart rate and GPS location and take the warning. After that, the MCU will set the status variable equal to 0. And at the final state, The MCU will display the data on LCD and store the data in SD card and keep do the new loop. How the patient and healthcare center can interact with each other. We consider this is the patient, the device at the patient location, and this is the device at the healthcare center. And when the patient has any abnormal heart rate, the device will automatically send an SMS including SOS signal and 10 heart rate recently to the healthcare center. It was shown on the line 1. And the healthcare center will analyze this data and decide to send the OK signal or need to confirm signal. It was shown on the figure by line 2 or line 3. If the patient receives the OK signal through SMS from the healthcare center, the MCU will do nothing more. But if the patient need to confirm signal from healthcare center, it will wait until the patient pushes the button SOS or the patient doesn't push any button in the allowed time. It's called no answer. The device will automatically send 20 heart rate data and GPS location information to the healthcare center. It was shown on the line 4. And when the healthcare center receives this signal, center will send the doctor and nurse to the patient location and immediately. As you can see on the GLCD, it shows the heart rate and the graph of the heart rate signal. And when the center sends a request data to the device, the red light in the device will turn on, and if the patient pushes the SOS button, the device will turn on the blue light and send back the heart rate data to the center. On the other hand, if we send a request SMS from the center, but we push the reject button instead of SOS button, the green light will turn on and send back to the center an SMS with the contents of OK. And if the center analyzes the heart rate data and find out that the patient health is very good, they will send the response to show on graphic LCD that don't worry, you are okay. After 3 months of hard working and researching, we finally complete our device with an acceptable accuracy. We especially give our thanks to our supervisors, Dr. Đỗ Thúc Kiên and Master of Science Lê Quang Thảo, Vietnam National University of Science, for helping us to the heart rate signal processing technique, determine GPS location and the design method of the project. And we also want to give our thanks to the Texas Instruments, Vietnam and Texas Instruments Incorporated, for providing us an excellent and appropriate device for this project, as well as sharing their experiences to help us deal with the problem causing in reality when we design this project. And in this last, we hope that our device will be an useful tool for monitoring heart rate in the future, and it can become a great reference for other teams who want to research and develop in this area.